Ladies and gentlemen, please welcome the President and CEO of the National Council for Behavioral Health, Linda Rosenberg.
Welcome to NatCon18. There are so many voices out there with stories to tell. I'm Linda Rosenberg, and this is my story. I ignored the chest pain and shortness of breath. I didn't have time to be sick. I had important work to do, trips to take, and grandchildren to play with. Finally, I couldn't ignore the symptoms any longer, and the doctors didn't sugarcoat my situation. 6 months ago, I had triple bypass surgery, and I'm glad to have had it in 2017. When bypass was first done in the late 60s, almost 10% of patients died before they were sent home. By the fall of 2017, I had the benefit of great surgeons at Columbia's Heart Center who followed standard procedures for what's become a common intervention. Since my surgery, I've been enrolled in a cardio rehab program. My primary care physician attends to my general health, including having a care navigator call me to remind me about screenings and appointments. All 3 of my physician groups have a patient portal where I can request appointments, send emails, and track my progress. I have good insurance and a strong support system of family, friends, and beloved colleagues. In short, I have all the right ingredients for a good outcome. President Obama told a recent graduating class at Harvard University, if you had to choose one moment in history which you could be born, you wouldn't choose 100 years ago. You wouldn't choose the 50s or the 60s or the 70s. You would choose right now. You choose right now because life is better now than it was 10, 20, or 50 years ago. Fewer people worldwide are impacted by war, disease, and starvation. Child mortality has been cut in half. More Americans have college degrees. People who are gay and lesbian have the right to marry. And hourly pay rose for every wage group last year, low, middle, and high. In behavioral health, some things are better too. Despite calls from some to return to asylums, we no longer warehouse people with mental illnesses, sometimes for their entire lives. Parity is the law of the land, and the Affordable Care Act survives. A bit hobbled, but hopefully strong enough to weather the slings and arrows. Effective treatments and recovery supports offer hope for people with emotional and addictive disorders. But celebrating progress isn't about being complacent. We haven't come as far as we could have or should have. While recovering from surgery, I had plenty of time to think about how different my story would have been if I had a mental illness or addiction. My surgeons agreed on my diagnosis and knew how to fix my heart. We don't yet fully understand the inner workings of the brain, and we're still debating highly effective treatments like ECT. My bypass surgery would have been the same whether I had it in New York, Kansas, or Colorado. We don't yet have national standards for treating mental illnesses and addictions. Instead of standardized treatment, what you can get depends upon where you are rather than what you need. My insurance not only fully covered the acute phase of my illness, but also everything I need to recover. I see my cardiologist, but I also see a psychiatric nurse practitioner who's helping me understand that what I think impacts how I feel. The surgery itself was a blur, as hard, if not harder, on my husband and family than on me. But when I awoke from surgery, suddenly the fear of dying was very real. It was paralyzing, and I couldn't navigate it on my own. After working mental health my entire career, I became the patient. I began to understand what it feels like to be the one who needs help. I saw firsthand the disparities in healthcare, but I was lucky. I'm a white, well-educated, upper-middle-class woman with good insurance for whom the system worked. Far too often, people with mental illnesses and addictions and their families are left fighting for care. Some end up receiving second-class treatments if they get treatment at all. We don't even offer them the simple niceties that we do for people with other conditions. After my surgery, my hospital room was filled with flowers. When I returned home, more flowers, candy, and books, and lots of food. Who bakes a casserole for the family of a person with depression or an addiction? Right. These are chronic conditions, just like heart disease. And like heart disease, people need help and need to learn to manage their illnesses. I've had all the help in the world to do this. I have the means for a personal trainer when my rehab program ends, to cover the high copay for the brand name medication that works best at lowering my blood pressure, and to have fresh fruit and vegetables delivered weekly. Where is the help for the divorced single mom addicted to pain pills? Where is the help for the elderly widower who is isolated and alone? Where is the help for the community college student experiencing his first episode of psychosis? Who is helping them change their stories? NatCon thought leader Omar Manjawala says, we need to make treatment the path of least resistance. That's why it will take each and every one of us working together to address the most serious crisis of our day, the lack of investment in science-based community services for people with mental illnesses and substance use disorders. This is the singular test of our time. Last year, 67,000 Americans died from drug overdoses. That's more people in a year than lost their lives in nearly 20 years of fighting in Vietnam. We are on pace to have a third straight year of declining life expectancy, something that hasn't happened in this country since the Spanish flu pandemic a century ago. Someone completes suicide every 13 minutes. And this crisis is nothing new. It's been years in the making. The nonprofit community mental health centers developed when we closed state hospitals have been starved to near death. Underfunded, they're labeled unresponsive. We cry public health crisis about the opioid epidemic, but invest primarily in beds and curbing prescribing, necessary but insufficient responses. Even the head of the CDC is shaking her head, wondering how to account for a rising death toll when opioid prescribing is steadily coming down. We use grants for time-limited programs to address a relapsing, remitting disorder. We encourage alternatives to incarceration without investing in the alternatives. Everywhere, people young and old, famous and not, are telling their stories. But for every recovery story, there are hundreds of individuals and families continuing to struggle, cycling through hospitals, jails, and the streets, alone and unable to get the help they need. In a Kaiser poll, 76% of Americans said they didn't know where to get care or how to pay for it. It's an even bigger issue than stigma. And 5 years later, the problems have only worsened. A report this year shows that nearly 1 in 8 human service nonprofits are technically insolvent. Their liabilities exceed their assets. If you don't take care of your business, you can't take care of your mission, says 2018 visionary leader Terry Crocker. Money matters. Without funds, community providers can't hire skilled staff. Low reimbursement rates lead to low salaries, resulting in limited and lackluster care. We have only about a third the number of psychiatrists we need. 70% of National Council member organizations lose money on psychiatric services. And more than half of all practicing psychiatrists only accept cash. And what of the young talent we hope to attract? Millennials may be idealistic, but they're also practical. With a wide open job market, the best and the brightest are joining companies that are using their new tax breaks to give pay raises and bonuses. Inadequate rates also stymie adoption of science-based practices and technology. Behavioral health has been front and center in delivering integrated care. But to keep integration efforts afloat, community providers cobbled together a series of federal, state, and foundation grants, each with different program requirements and reporting requirements. National Council members also understand, courtesy of a flood of venture capital and private equity money, that there are thousands of new digital health technologies. They've read about care coordination robots, learned about eCBT, and seen demonstrations of artificial intelligence. Behavioral health can be both high-tech and high-touch, but adopting the technologies that could improve care is out of reach for most community organizations. Innovation is expensive. I'm not telling you this story for you to feel dispirited. Far from it. I'm telling you this story to galvanize you for the work that lies ahead. We can write a different ending when we have new stories to tell. The 2014 Excellence in Mental Health Act that you successfully championed established certified community behavioral health clinics in 8 states. I saw them last night at their reception. And when those community clinics provide evidence-based care, and when they are compensated for the cost of care, they transform access to care. CCBHCs are hiring, yes, are hiring psychiatrists and addiction specialists, serving new patients, initiating or expanding medication-assisted treatment. And I just heard from Mohini Venkatesh, our vice president, that one of the centers has bought about 1,300 iPads for their criminal justice partner, for their patients, and for their other partners in the community. CCBHCs are offering same-day access. When a person seeks help, we can't tell them to wait a month for an appointment. I couldn't have survived if my cardiologist told me she'd see me in a month. We must be ready to provide help when they are ready to receive help. CCBHCs can be a lifeline for patients and struggling nonprofits. They help level the playing field by providing the same payment structure that federally qualified health centers get. But not every behavioral health organization can become a CCBHC, and CCBHCs can't be the only way to deliver comprehensive care. We have to be open to new structures and new players. Apple, Google, and Amazon are well on their way to erasing assumptions about who can deliver health care. Google has spun off a new business called CityBlock that will offer integrated health, behavioral health, and social services to low-income Americans, promising to do it better and cheaper. Health plans are increasingly partnering with organizations that are financially sound, have an infrastructure for value-based payment, and can assume financial risk. This changing marketplace has some community-based members joining hospital systems, and our hospital members are expanding their community services. That's why National Council member Memorial Hospital is an Award of Excellence honoree for its commitment to the overall health and well-being of its community. The American Hospital Association selected Memorial from more than 5,000 hospitals as a national model. The Cone Veterans Network is another new delivery structure that's fast becoming a model for improving the health of veterans and their families. Founded by philanthropist Stephen Cone, CVN provides services through a nationwide system of mental health clinics. This is a unique role for philanthropy, making an ongoing commitment to underwrite the direct provision of services rather than funding a specific, very time-limited project. IPAs and mergers and acquisitions are creating new healthcare structures, and probably no one understands this more than David Guth, CEO of Centerstone America and a former visionary leader. We all know that times of dramatic change are times of enormous risk and tremendous opportunity, David says. Under his leadership, Centerstone has grown from a single nonprofit to become a national provider network serving individuals in multiple states, including a CVN clinic at the Centerstone facility in Tennessee. When he counsels other agencies looking to create similar networks, David has them start by imagining the characteristics of an organization that could pose a threat to their own. What services would that organization offer? What infrastructure would it possess? How might it use technology more efficiently? But sometimes nonprofit boards balk at being acquired by a larger entity, even when it means continued survival, because they fear they won't be able to continue their unique mission. I know these are difficult conversations to have, but we can't shy away from difficult conversations. To survive, we must become the competition, affiliate with them, or risk becoming obsolete. At the National Council, we're not afraid to have uncomfortable conversations. NatCon Plenary speaker Brene Brown tells us we're going to have to learn how to listen, have hard conversations, look for joy, share pain, and be more curious than defensive. Over the next 2.5 days, the influencers, the advocates, and the agitators will tell their stories, and they will challenge your beliefs, but you'll be stronger and more determined for having done so. Then we're going to board buses for Capitol Hill, where telling our stories is beginning to pay off. Together, we've been telling our stories, and Congress has listened. The omnibus spending bill boosts federal health spending by more than $10 billion. It provides increases for the programs we support, nearly $16 million for mental health awareness programs like mental health first aid. an increase of $160 million for the mental health block grant, funding for the primary and behavioral health integration program, and a doubling of funds to $1 billion for state grants that address opioid use disorders, and $100 million in new funding for CCBHCs. We got more money for CCBHCs because we're proving that they make a difference. But let's not kid ourselves. $100 million won't take us all the way there by a long shot. Richard Kirschenbaum, who wrote Isn't That Rich? Life Among the One Percenters, he said billionaires view $100 million as the starting point for real money. And let's not forget, this is grant money, money that will end. When I needed heart surgery, I didn't have to find a provider who had a grant and hope it lasted long enough for me to live. We must stop pretending that we can take a demonstration program, get it up and running, start delivering results, and then when the funding runs out, we scramble to keep it running so patients don't die. That's not the way we treat heart disease or cancer, and it shouldn't be the way we treat mental illnesses and addictions. So our story doesn't end here. As Margaret Thatcher said, you may have to fight a battle more than once to win it. When we go to the Hill Wednesday, we'll be prepared with our asks. Ask to expand the Excellence in Mental Health and Addictions Act. Ask that opioid treatment be included in Medicare. Ask that mental health and addiction treatment centers get electronic health records. Ask that SAMHSA priority programs continue to be supported. And ask that the workforce crisis be addressed. My mother, may she rest in peace, told me that if you don't ask, the answer is always no. And if you don't step forward, you're always in the same place. We're not in the same place we were 49 years ago when the National Council was founded. We've grown to be 2,900 member organizations strong, caring for over 10 million men, women, and children, because we haven't been afraid to ask. And we haven't stood still, not for a moment. The Reverend Martin Luther King said, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. Next year, I'll be moving forward to a new phase of my life and career. A decision made before my heart surgery, but one that feels even more important to me now. I'm leaving after 15 years as President and CEO of the National Council. But my heart and my spirit are stronger than ever, and the National Council is stronger than ever. It's time for a new leader to take the reins and lead the Council into the future. But I know I'm leaving all of you in very good hands. I'd like you to give a round of applause to our wonderful board of directors, all of whom are in the audience, led by the indomitable Jeff Richardson. Without their foresight and support, we wouldn't have a success story to tell. Woo! And how about our outstanding employees? From a staff of 12, we've become 140 strong, and for a budget of $2 million, we've become a $50 million organization. Along the way, I've been honored to work with the most talented, compassionate, dedicated professionals in the business. You'll see many of them here today, ready to serve you in their trademark National Council blue scarves and ties. Please, let's give them a warm round of applause. And No round of thanks is ever complete without honoring our Executive Vice President, COO, and Conference Planner Extraordinaire, my partner in every crime, Jeannie Campbell. Jeannie, please stand. Where are you? So I'm stepping away from the council in August 2019, but I'm not retiring from this challenging and rewarding work. When she was asked about her plans to stop touring, the Queen of Soul, Aretha Franklin, made clear that she'd still be making music. She said, "I feel very enriched and satisfied with the respect to where my career came from and where it is now. But I'm not going to do just nothing. That wouldn't be good either. I too feel very enriched by the work you've given me the privilege to do. My time at the National Council has shaped my story, and I'm not going to just sit down and do nothing because I still have a story to tell. I'm going to tell my story and encourage, no, I'm going to insist that it become the same story for every man, woman, and child in this country with a mental illness or addiction. I want them to have the same access I had to high-quality, science-based treatment regardless of their race, gender, or income. I want them to have insurance coverage for prevention, treatment, and recovery services. I want them to be supported in seeking help and offered compassion and hope and given every possible opportunity for a full life in the community. Because of the support I've received, I've gone from being fearful of dying to being grateful for being alive. That's my story, and I'm privileged to share it. Thank you.